So Namaskar everyone, I am here again with one more new learning experience which I am going to share from Burnett tumors, and this is Burnett's tumors. That's what we are talking about in our lecture series. And today I am going to talk about a chapter number 21 and 22, and there is something really important to learn from this case. Of course you can go back and read the case. I'm not going to analyze the entire case, but yes, this case, let's start with. This case starts with a tumor, there was a cyst and there was an arthroma of scalp, and a lot of remedies were given one after the other with the indication, of course. But the most important thing was, I'll read directly from this. Patient tells me she once had suppressed measles, suppressed smallpox, and also typhoid. On this basis, he used verulinum. Verulinum is a nosode which is used in suppressed smallpox. When you have smallpox in the past history and it was suppressed, verulinum is the remedy. And of course, verulinum did a great work here. In this case, he also talks about a few organopathic remedy because spleen was involved also at that time. So for splenic remedy, he had given few remedies, organopathic remedy, then he had given nosode and some homeopathic indication based remedies also. Now I'll directly jump to the next chapter, chapter number 22, where it is a case of tumor of left hypochondriac region. It was a very big tumor on the left hypochondriac region. And what he found out, there were two things he found out in the case. Now there are certain times when patient comes to us and there is a tumor, like suppose there's a growth, and you're trying your level best, but you're not able to get the totality. Or even if you get the totality, the patient maybe mentally, emotionally he improves, but the tumor or the swelling or the glands which are enlarged, they do not move. So it is very important to go into the past. The evolution of the history is very important. So go into the past and find out what are the illnesses that he has suffered, what are the acute diseases that he has suffered. Because the acute diseases that he suffered can also be one of the primary indication of starting your remedy. Like in this case, he had two things. He was never vaccinated. There were no major problems in that. But the most important thing that he had variola. Like suppose this patient is 50 years of age. When he was 8 years of age, he had a injury from a horse on eyebrow. Horse leg on the eyebrow. He was maybe standing. This was one thing he found out. Second thing what he found out in the history was he had 40 years back, he had variola. And on this basis, variola means smallpox. So he had smallpox, and on this basis, what he did is that he took both the causes. He took the injury cause, he took the acute disease cause. So first he gave verulinum. He started his prescription with verulinum. And verulinum did a great deal of reducing the pain, the tumor and swelling. And later part he used Belisper, which also is a very good remedy for abdominal tumors, cancers, especially with the past history of injury. So what are we trying to talk about here and discuss, and what did I learn from this case? What I learned from this case is, he says very nicely, the effect of acute disease, I'm reading directly from the notes. Now the effect of acute disease on the economy are known to last very long time. How long does it appear is to be determinable. How long? Like suppose in this case he is 50 years of age. The patient is 50 years of age. 40 years before, patient had variola, a smallpox. Before that, the 21st chapter, what we saw, a case of a scalp arthroma. We saw that suppressed, all the viral infections were suppressed, like measles, smallpox was suppressed. Okay, basically chickenpox or whatever he had, it was suppressed. In this case specifically, he had acute disease, which was smallpox. Why I'm saying chickenpox more? Because nowadays we see a lot of chickenpox coming. Yesterday only, I have a patient, the entire family got chickenpox, and now the lady who is around 34-35 years of age, she is now suffering with chickenpox, and I'm treating her right now. Yesterday only I gave her remedy. So now it's a very important part. Why I'm discussing this topic is because in day-to-day practice, a lot of people are giving vaccines, and vaccine are said to be the best survival, the best medicine, no disease you will get. It is not happening like that. The diseases do come. They find the expression not in the childhood. If you suppress in the childhood, it might come in the later part. So now, how do we tackle these cases? How do we use this idea? How I use this idea is that the nosodes, especially variolinum, morbillinum, varicella, then streptococcinum, staphylococcinum, all these nosodes. Then we have got bacillinum. When I find in my patients in the past, when I go and I find some indications of diseases, he suffered from typhoid, he suffered from malaria. A lady came to me suffering from recurrent urinary tract infection. So maybe I will think of E. coli as an intercurrent remedy, or maybe to start off the patient, the case itself with the E. coli. These are the Zoic remedies which really help you many times to stir the vital force and take you to the deeper level and affect it in a better manner. What I'm trying to say is that, like, we have a lot of time questions like organopathic remedies. Like, suppose the remedy that we give on the basis of organ, very specific organ remedies, chelidonium, a ceonanthus, a spleen remedy, and then we talk about a Zoic remedy. What is the difference? Now, Burnett uses many times organopathic remedies, and many times he uses Zoic remedies. Zoic means the nosodes, basically the anti-miasmatic remedy. Etiological homeopathy. This is what term used by Hahnemann. In last letters of Hahnemann, Rima Handley book, if you read, and Hahnemann's chronic disease, which you read, and later part of Hahnemann, he was focusing his practice on etiology. He was trying to find out the etiology, and this etiological basis is the derivation of the miasms. The Zora, psychosis, syphilis, it is based on etiology. So for us, it is very important to go back into the past histories and family histories and find out the evolution of the illness. Which are the illnesses that he has suffered? Which are the complaints that he is having? So when you find out those things, then you have really nailed it, and you really get the answer. Like, suppose I can give you an example. A lady comes to me. A lady came to me and she was having multiple complaints. When I went in the past history, I found out recurrent tonsillitis since childhood. It continued till teenage, and she used to get tonsillitis. Of course, it was not operated. A lot of tonsillitis, and then of course sequence of diseases came in. The remedy that I gave, not in the beginning, I gave in the middle of the treatment. The nosode was streptococcinum, and it really helped. Another thing is, like, a patient comes to you with a past history of pneumonia or weak lung, or many times lot of tubercular deposits are there, or weakness of weak lung is there because of the inflammation and recurrent infections of the lung. Bacillinum could be one of the very important intercurrent remedies. Same with measles, morbillinum, chickenpox, varicella, and these diseases. What I'm trying to say is that what I have understood and what I do in my practice is, you have to go back and trace the acute disease. Like, suppose somebody gets an acute disease, a viral disease, or some acute disease comes, the bacteria or the virus attacks. Disease goes, physically patient is okay, the fever, discomfort is gone. But many times the imprint of the disease, like suppose chickenpox, measles, the imprint which is there, or which is suppressed, if it is actually suppressed by allopathic treatment, the impression, the dynamic impression which is there, it still remains. And it's very hard. It is very hard to remove that impression, and that is the reason your well-selected remedies many times do not work. So if you find this trace, maybe it is 30 years, 40 years back, this could be one of the indications of using these nosodes judiciously. Judicious use of these nosodes. Nosodes, when you use, whenever Zoic remedies or nosodes you use, actually what you do is that nosodes and Zoic remedies have power to remove the diathesis. I'm telling it again, please listen to this carefully. The Zoic medicines and the nosodes or the anti-miasmatic remedies that you use, these are different terms. Zoic medicine, anti-miasmatic, nosodes are different terms. Same meaning. When you use these remedies have power to remove the diathesis, the tendencies. And when the tendencies and the diathesis is removed or it is lowered down, then the recurrence or the illness frequency, the intensity of the disease comes down. Many times our remedies act, but again it relapses or some other big complaint come up because our remedies are superficially acting. Maybe we think that everything is matching and everything is good, but it is not going deeper. It has to go deeper until unless that remedy that you're giving touches the range of action that he talks about, touches the past illness, the evolution of disease, past what happened. On the basis of that, when you give it, that's when the remedy actually touches the depth of the vital force and it stirs up the the harmonious way what we are looking for. It helps the vital force to regain its original strength. So that's what is from my side. I hope this little understanding about this, a short video I made because I wanted to share this information with all of you. Please try it in your clinical practice and see the wonderful results that it follows. Thank you very much.